Hello, you've made it to the third part of the physiological changes in pregnancy, and here I'll try to squeeze in what is remaining, which include respiratory and pituitary changes. Okay, so in pregnancy, we know that pregnancy is divided into three trimesters. We have the first, the second, and the third trimester. Okay, so during the first trimester, which is about 1 to 3 months, the respiratory rate in the woman increases. Okay, so her respiratory rate increases. So respiratory rate increases due to the increased amount of carbon dioxide produced by the fetus. So if there is an increased CO2 in her bloodstream or in her body, we know that the carotid bodies and the aortic bodies and also the central chemoreceptors will detect the increased CO2. So if this was the brainstem, right here, we have our inspiratory group, and we have our C3, C4, and C5 spinal roots, which is the diaphragm's spinal node. So, and this is the carotid body and everything. So this is the carotid body and the aortic body. When these bodies detect increased CO2 in the blood, they send a signal to the inspiratory respiratory group via the cranial nerve number 9, occlusopharyngeal, and the aortic body uses the vagus nerve, cranial nerve number 10. Okay, so once the inspiratory respiratory group recognizes this increased firing rate because there is increased CO2, it sends a signal to C3, C4, C5, keeps the diaphragm alive, which is the phrenic nerve, and to the phrenic nerve, it increases respiration. So the phrenic nerve will contract and it will pull down. So I'm just going to write here. The phrenic nerve would contract. When the phrenic nerve contracts, it goes down and increases the respiratory diameter. So it increases that diameter right here. And when this diameter increases, the thoracic diameter increases, the pressure in the thoracic cage decreases. And according to many laws, pressure travels from an area of high pressure to low pressure. So if atmospheric pressure was high, it will now go down its gradient into the lungs, and that's how we breathe. So when the phrenic nerve contracts, it increases the vertical diameter, creates a negative pressure in the thoracic cage, and since the atmospheric pressure is more positive than the intrathoracic, air flows down its gradient and into the lungs. So this is how respiratory rate increases during the first and second trimester. During the third trimester, however, her respiratory rate decreases. Her respiratory rate decreases because her uterus, so if the phrenic nerve was right here, her uterus will soon increase in size. Her uterus will increase in size and push on the phrenic nerve. It pushes on the phrenic nerve and it pushes on the lungs. So if her lungs was in here, pushes on the lungs, and the diaphragm pushes on the lungs, and it causes dyspnea. So it will cause difficulty breathing. So in the first trimester, we have an increased respiratory rate, but in the third trimester, we have dyspnea. Okay? So this has been the respiratory changes in pregnancy, and I hope that was helpful.